I'm a 40-something mother of one who reached a 5-year-old that Dr. Sam delivered. One of her largest deliveries, I must add, because you know I'm competitive. 9 pounds, 12 ounces, 2 weeks early. I think Dr. Sam brought in another doctor to grab her. We have a beautiful shot of them grabbing her as she's coming out because she was huge. I was ecstatic. I decided I was gonna get, you know, the good thing with Dr. Sam is that she knows as a professional woman, we plan everything. I literally came to her and said, okay, I want to get pregnant and I want it to happen now. And then I called her 6 weeks later and I said, I'm pregnant. And she laughed at me. She said, no, you're not. I said, order the blood test, I'm pregnant. And I was fortunate enough to be able to do that. I was 35 years old at the time. And, you know, Dr. Sam just held my hand along the entire way for the pregnancy. From, you know, the different emotions I was feeling to the days when I was a little nervous because it is my first and only child. But I had a wonderful time. I felt awesome pregnant. I was one of those lucky people that just loved it. Dr. Sam really cares and she really listens. We have this little thing, the two of us, because she knows I'm a reporter and I'm a journalist. She knows chances are when I call the office, I've already diagnosed myself, researched my illness, and I have a prescription ready to go. We have this argument all the time. She keeps telling me, Nikki, I can't just write you a prescription you tell me to write you. I said, no. I said, but I've analyzed my symptoms, I've checked all the websites, I've referred to all the journals, and I know this is what I have. And she's enough of a professional and she is enough of a person and a human to most of the time say, you know what, you're right, that's exactly what you have. But I need to see you first. So we have this, she is very educated, on top of her game, but she listens. And sometimes, you know, just that person listening to their patient, because, you know, you may be a doctor, but this is my body. So it is a good teamwork effort when you're dealing with anything from pregnancy to have other conditions that she's dealt with. She always listens. And I think that is the most important, one of her most important qualities, because she really does care. There were times when they didn't know I was gonna make it. They did not know I was gonna make it. And I would wake up in the morning at the hospital and Dr. Sam was at the end of my bed at 5 in the morning in tears. Because we will pull in everything, you know, I had a newborn baby. Dr. Sam signed herself off of my case completely and brought in 2 new doctors. She says, maybe there's something I haven't looked at, but I'm stepping off of this case. I'm still gonna be here every day, but I want as many people as possible to take care of you and help you out of this. It was a very scary time in my life. And she was there every step of the way. And by the grace of God, we pulled through. And everything has been wonderful. It's hard as an older woman. It's not, you know, people think, oh, you know, you're 35 having a baby, that's not that old. But in the reproductive world, it is. That's why you need someone taking special care of you. One of the best features of this program is the one-on-one attention and the instant communication. Because a lot of times when, especially if it's your first baby, you know, you have a question, you're gonna think about that question until you get it answered. So if somebody takes 8 hours to get back to you, you have 8 hours of agony and 8 hours of being nervous. You know, when somebody gets back to you in 1 minute, it makes that day so much easier. People talk about pregnancy brain. It's pregnancy brain, the reason you can't remember anything else is because all you're thinking about is that baby and what's gonna happen to that baby and what's going on with your body. And so many things can happen and so many things can influence that, and getting to it sooner, getting it to earlier. Sometimes just having your mind at ease is gonna make your pregnancy better. And I honestly think, like I said, I have the happiest child in the world. And I think part of that is because I had one of the happiest pregnancies in the world. And part of not having to worry was being part of this program. I budgeted very, very carefully. At the time I had no other children. But I cut out other things. I'm sorry, I was gonna have 1 baby for 10 months. I cut out dinners with friends and happy hours to be able to pay the program and have the fee, because that was most important to me at the time. I don't do anything halfway, so this certainly wasn't gonna be one of them. In this office, my child felt like the only one that mattered when I was here. And to me, that was priceless. And if it's worth it, I'm gonna pay for it. If you are able to invest in it, if you, especially if this is your only child and you're having it later in life and this is your first child or maybe your second, or maybe you lead a really, really busy life, this is one less thing you have to worry about. even for someone that has all the time in the world, sitting in an office where you're waiting forever, you can wait for an appointment in other offices for 3 hours sometimes, and you're only with the doctor for 10 minutes. I calculated what my time was worth, and I agreed that her price was worth my time.